So, ladies and gentlemen, weighing in with over 20 years of experience,
Inshallah.
trained in Michigan, specializing in breathing, COPD, sleeping disorders, a man who studied the lungs, the mind, and the battlefield of the body, the doctor you call when other doctors don't know what's going on, the only doctor who'll draw you a diagram, prescribe you a cure, and hit you with a psychology lecture all in one breath. We've had him on before, and he's back for round 2. And since our first episode, he's gone from clinic rooms to trending reels. Give it up for the most viral doctor on the planet right now, Dr. Fawzi Katranji. Assalamu alaikum, Doc. How's it going?
All right, wa alaikum assalam. Thanks for that hype, man. Oh my gosh.
We needed it, man. You deserve it. Things have been crazy for you right now.
Unbelievable. I was completely shocked. I was completely surprised. I mean, I got a text from you telling me I was trending.
Yep.
And I got a text from my brother telling me I was trending. I had no idea. It was like a 3-minute kind of post on AI, and went home that day. And I think the next day, I got text, are you on Twitter? I said, no, I'm not on Twitter. And they're like, well, you're trending on Twitter, or you're trending on X. Oh, well, I couldn't believe it. I was like, I'm only on Instagram and I'm on TikTok. That's it.
There's trending and then there's viral. You, sir, went viral.
Yeah.
So, for those who don't know, first of all, like the other thing it shows is the importance of consistency, like anything, because you stayed at it. And to be honest, I didn't know if you would. When we spoke after our first episode, I was like, look, you got to do the content, man. Like I said, 20 years of experience, and you got so many gems to drop it, and people would benefit from it. And you actually stuck to it. And we'll extract the lessons in a minute. But for those who don't know, Dr. Fawzi just created a reel, an analysis of some lungs that he's kind of done previously, and like you've done it a few times, haven't you? Like you recorded lungs to something, an X-ray of lungs to some capacity, but this time mentioned that it's interesting. Well, why don't you kind of let us know kind of what the reel was, and then what happened kind of after, I guess.
We introduced a new software in our system, in our computer system, where AI can actually analyze an X-ray and X-ray images. And they were introducing it initially to our emergency department, and now it's in our clinics. And, we have students coming in every day, and I spend like an hour, teaching them how to look at an X-ray and how to kind of assess and analyze an image, and ask them things like what pops out. So, to kind of develop an eye for what to look for on those images. Then all of a sudden, the hospital's like, well, here's this image. And just the AI is telling you, you got pneumonia here, you got pneumonia here, you got a nodule here, you got, fusions there. So what used to, take time, looking at an X-ray, thinking about the patient, in like 2 seconds now, or less than a second, you're actually given an answer. And so you think to yourself, man, all of that work and some kind of software with some deep learning equation figures it out a lot faster than you can.
And then you created a reel about it.
I created a reel about it. It was the end of the day. I was kind of depressed, I think. Here's the AI taking over my job, and 3 minutes. In fact, like if you look at I would try to hide the ID of my patient, and I thought to myself, who's looking at my TikTok? So I just get it like a tissue, and I put the tissue to protect the name of my patient, and that's what I know this thing has gone viral, but every time I look at that video, I'm like, why did I use that tissue?
Oh, really?
I should have used something a little more professional.
And
but just like 2 minutes, 3 minutes, and that's it. Posted. Viral within the next day, within 24 hours.
Yeah, because I think like 24 hours later on your, it wasn't necessarily anything. It was doing bigger numbers, I suppose, than it usually does on your Instagram. But really, the big hit was on TikTok, where it went to 800,000 views.
It's over 1 million now.
Yeah.
That's
incredible. And then it just picked up from TikTok, I guess, right?
From TikTok. Then of course I moved it to Instagram. And, people are encouraging me, okay, get a Twitter account, get that. But the problem is it's hard to see yourself as a social media person.
Right.
So you tell yourself, what's my purpose? What am I going to do this for? And honestly, that's why I use you. I mean, you're an inspiration for me, wallahi.
No.
So it helps a lot, to have somebody to talk to and bounce ideas off.
Hey, before we jump into the rest of the episode, just a quick message to say that if you've ever laughed with us, learned something, or felt that spark of connection through these episodes, you can get access to much more over at our Patreon. By joining the Freshly Grounded family, you'll get an extra weekly show that's hosted by members of the Freshly Grounded team. You get access to our exclusive brothers only and sisters only online community space. And most importantly, you help us keep the mics on and keep the mission moving. So if the podcast has ever hit home, don't just stand at the door, knock. Join the family at patreon.com/freshly grounded. Okay, now let's get back to the episode. Oh no, it's incredible. And so then basically what happened is it started getting picked up with accounts that have, I saw one account that has 1.9 million followers. No, sorry. One account that had 2.4 million followers posted it, like an AI account. And then I saw another account that had like 4.9 million followers posted it.
Yeah. And then all the likes and all the, shares.
Yeah.
Sunday, I was double booked. And literally, I think maybe 10 of my patients said, we saw you on Instagram. We saw you on TikTok.
Do you think they booked you from that?
I have a feeling they did. I have a feeling they did because I was busy.
It's very rare you get to see real world.
Yeah. Unbelievable.
That's incredible. And then 10 of your patients mentioned it.
They said, hey, is that you? Because I didn't put my face.
Yeah.
One of the issues I have with I don't know why, but I can't do this, look at my face. I am doing it, but there is still this like shyness in me that kind of doesn't like it. But is that you? Because all they did was recognize me by my voice.
Well, you have a very distinct voice, and I actually same thing. So I didn't even see it first on your profile. I saw it on somebody else's profile that has 2.7 million followers. They posted it, and I was like, I recognize that voice. And then I like DM'd, because I know this guy who shared it, and I said, that's my doctor. So very incredible. And yeah, so I thought to myself that there's a few lessons that actually you can extract from that. I do want to go into the whole actual the content of the reel as well and talk a little bit about AI and medicine and where you think that's going. But I did think that there were some benefits from the actual that whole scenario from a content creating perspective that's worth reflecting on. And one of them was kind of what we mentioned at the beginning, which is consistency, right? Yeah. Like you had kind of, after I pushed you a little bit, decided, look, I'll create some content. And, I was explaining to you that there's a lot of people creating content who know that the content game is the game to be in right now, but they don't have the substance. And you were kind of the opposite, where you got 20 years experience, you're a consultant doctor, Allah Barak, you really changed the lives of your patients, and I have a first-hand view of that. And it'll be amazing if you could either, help other people who are trying to be doctors or other doctors, junior doctors, or just help the consumer is a weird way of putting it, but help the consumer essentially by educating them a little bit more on themselves, because I would benefit from that. And because you have that substance, because you've got that experience, when you speak, it actually kind of matters, right? And you would reluctantly agreed, and so despite not having the best cameras, the confidence to put your face on screen and all of these kind of things, you still created content and you created it consistently. So consistency was the first thing I thought that was like incredible. The second thing was what I just mentioned, which is not having to rely on the best studio, the best cameras. It's like, just get the content out there. You did that as well. And then the third reflection that I had was spreading your content far and wide. You posted the same piece of content on Instagram and TikTok, exact same piece of content. But on TikTok, it got over 1 million views. At the time I checked on Instagram, it was about 25,000. Yeah. It wasn't going viral on Insta, but on TikTok, it got picked up. And so again, it's like you've gone as far as creating the content anyway. You might as well post it on all of the platforms, because you just don't know which platform is going to pick up. So to whoever told you to jump on Twitter, kind of there's validity to that, right? And then there's now software like what we use. We use a website called buffer.com. So we'll upload a reel once, but it gets instantly posted on like 4 different platforms at the same time. So you could post on Instagram, TikTok, Twitter, and YouTube Shorts. Okay. And so we're just like maximizing our chances of virality. And so we've had that happen where something's gone viral on YouTube Shorts, but not necessarily on Instagram. And so if you can still post it once and it costs like $10 a month. I think they even have a free version, but like you've experienced, imagine if you just didn't post it on TikTok. Now you don't have to worry because you can just post it all out on one platform. So yeah, there's some of the benefits that I kind of took.
Is that an
from
app?
posting that.
Buffer is an app?
Buffer's a website, buffer.com.
Okay.
So you'd create the video on your phone, airdrop it over to your laptop, and then just at the end of the day, just throw it on there. Just like one thing that you do at the end of every day, just post it, and then it gets posted across all your accounts.
That's impressive. Actually, that might not be a bad idea. You don't have to worry about creating different content for different accounts.
Yeah.
What I thought was weird was that people shared my TikTok on Instagram. So even though on my account itself was like 25,000 views, like on those other accounts, there were like some kind of Middle Eastern Arab accounts. I think one was like Swap or something. They had well over 200,000-300,000 views. So, but that doesn't count towards your own Instagram.
That's right.
They just take it, repost it.
No, but it all helps because it gets the message out there.
Yeah.
And like they say, any publicity is good publicity to an extent, right?
True. Yeah.
I think the reason your TikTok potentially got shared more is because it's easier, or it's kind of in the culture of TikTok that you can download other people's TikToks and then re-upload them. With Instagram, provided you've got those settings turned on, I can go to your Instagram profile and download your reel and then repost it. But it's not really like the norm, and it hasn't like seeped into kind of like the culture of Instagram. Whereas with TikTok, it's very much in the culture where you see a TikTok that you like and you can like download that TikTok and then you can like send it across WhatsApp and stuff like that. And what another thing that's quite interesting is that if it's done millions of views, which it has now across various social media platforms, that means that it's done even more millions on WhatsApp, because WhatsApp is the hidden social media that nobody talks about and nobody realizes.
Right.
But that's really where virality lives, when your video gets shared on groups on WhatsApp and stuff like that. And so I'm sure you must have like just been, all over WhatsApp. I was going to ask you, what's been the real world effect of that? One you've mentioned is that you were much more booked up, but even from an angle of people speaking to you about it, and then also your followers, did you see an increase in your followers and stuff like that as well?
Oh yeah. Oh my gosh. I don't have like millions of followers, but I think I had like 3,000 or 4,000 followers on TikTok. That's more than doubled. That's for sure. So it's not that special. I know there's tons of people with hundreds of thousands, millions of viewers.
But doubling in a few days is incredible.
Unbelievable. And same on Instagram. I think, I think Instagram, I had like 500 followers and now I'm 1,100 followers. And, doesn't sound exciting, but it's impressive to me. And then you have TikTok. I think I'm well over 6,000-7,000 followers. Whereas before I had nothing. I had maybe a couple thousand, and you'd get some likes. Every post would be like 300 to like 800 views. Yeah. So yes.
I think it's important to talk a little bit about it. Might be a bit of an uncomfortable topic, but I think it's important to talk about why, as a doctor, having content do well on social media and actually having a social media brand is important. And the reason I say to you, it might be obvious coming from the States and then practicing also in the UAE. But our majority of our audience is in the UK, where obviously majority of doctors practice under the NHS. And so something that's new, I don't know, Suleiman, if you have seen this, because you obviously are recently from the UK, but in the UK, have you noticed a difference with how like doctors are presented in the UK versus the UAE at all?
Not as of yet. No.
Have you been driving the motorway and seen like a billboard of a doctor?
Yeah. I heard that your local doctor, you can see him on the billboard.
Stuff like that.
Yeah.
Okay, that's
No,
impressive.
here in the UAE.
Oh, here in the UAE. Oh, yeah.
So that's kind of like a bit of that's like a part of it. Like that's like one of the differences. But really like underneath that, what that essentially means is in the UK, you just, it's all under the NHS. A doctor doesn't necessarily need a social media profile. It doesn't benefit them at all, right? Outside of the UK, where medicine is privatized, like in the States, for example, out here, you notice that doctors need to kind of get their name out there, because like any other profession, it's a job. And if you're not busy and you're not booked up, then it can have like a ripple effect, and especially on your finances. And so when I came out here, I noticed that there'll be like billboards of like doctors, and it'd be like they're like promoting their services. At first I was like, oh, that's like insincere and weird. But then I came to kind of like appreciate it, because I was like, well, that's just business. And it's like, this is your profession. This is what you studied in. If I've studied as a graphic designer, I need to now promote my services and say, look, get your
what I
designs
do.
up from me. This is what I do. And it makes sense that that in the rest of the world it's like that with doctors. It doesn't mean that you have to be insincere. It doesn't mean that you have to be like someone who's capitalizing off the ill health of others. But it's like, if you're gonna go, if you need to get your health checked for XYZ, hey, like I offer those services. And so out here, I see there's a huge benefit in that, in you having a brand. That's why I'm so happy that you were doing it, because I'm like, look, if you can. Because I actually experienced you as a patient, you go through experiences of going to bad doctors and good doctors. When I say bad doctors, I don't mean like they're bad, but like you can have good and bad experiences, right? And so when I had a great experience with yourself, and I've mentioned in the old podcast about how you really walked me through what was going on in my lungs and what I was experiencing, and I was like, oh man, like if more people, if they have like issues with their asthma or their sleep apnea and stuff, like they should go to Dr. Fawzi, because actually like he can help walk you through the issue. Why don't more people know about it? And so from that angle, so there's one angle which is the money side of things. Like it's good for business that your brand, that you represent your brand and you kind of have a brand online. But then secondly, it's good for like the world, right? Like it's good that like there's more people educating individuals on their health and stuff like that. So that's, I thought it was important to mention that. That's why, we're not talking about this from a superficial perspective of, likes, views, and stuff like that. It's more so there's a genuine effect. And this is probably one of the few fields, medicine, where actually having a profile actually benefits. There's a mass overall benefit here, as opposed to like when you look at it from the pros and cons perspective. There's like one would say a utilitarian like benefit, right? Like,
yeah, I mean, there's the two ways to look at it. 100%, you want your name out there, because I mean, what are you doing if people don't know who you are and you don't get to benefit them? So it's important, whether you look at it as a business point of view or volume point of view, where people are coming to you for the help that that you can provide. That's very, very important. And then there's this other kind of class, I think, of doctors that I notice online, is a lot of us are trying to fight a lot of misinformation, and we want to educate a lot of people because there's so much information out there, and it's kind of, on what do we call that? An algorithm. It's going up super fast. Like all this misinformation about medications, drugs, things you can take, things you can't take, tests that you do. So one of the things you want to do is also educate as many people as possible. A lot of my focus is trying to, I think one of the reasons I don't know if I necessarily go viral enough is because I think I focus a lot of my content to other doctors or doctors in training. Like, this is how you look at an x-ray. This is what you're looking for in a sleep study. Because every doc can order a sleep study now. Every doctor is ordering a breathing test now. But 99% of these doctors don't know how to actually read the study. So you might as well get them educated on it. So that's kind of the part of that goal. And so, it's a double-edged sword.
Now that you have seen the effects of having something, get tens, if not probably at this point, 100 million views online in some capacity.
Yeah, I'm a big deal, by the way.
Yeah. Would you recommend other doctors to build their profile?
Man, I would recommend that you know what your intention is. That's what I would say. What is your goal? What is your intention? What is like this little voice in your head talking? And then build your profile based on that. Yeah, but I don't know if just creating content, maybe that is necessary. I don't know. I don't see that way. But you just have to have a goal. You have an intention, a purpose. And yeah, 100%. If you do, social media is the best way to do it. Social media is the best way to do it.
Well, I've never seen you on a billboard, right?
No.
But you've, the amount of money those doctors are probably paying for those like Sheikh Zayed Road billboard, like prime time spots.
They got cash.
They would not have reached the amount of reach that you managed to get with that one viral video. And so that's like the difference between understanding that digital is the way forward and capitalizing off of it.
Yeah. That is true. That is true. And it's getting more and more important. I think just kind of getting older and figuring that out now is, maybe a little sad, but it's better late than never. So
I mean, you're in your 30s now, right? So
yeah,
you
yeah,
gotta-
100%, 49. But yes, but that's a new 30, right?
yeah, right? Anybody? I was asking you before we move on, because there's a few things I want to speak to you about, but I was asking about the real world effect, of that like virality. So what was it like in person though? So your followers doubled, but what about like outside of the increase in bookings, your family and friends, did they kind of pull you up on it?
Yeah, yeah. I got a lot of very friendly comments. Some not so.
Did you get some not so friendly comments?
But I got all my friends. God bless them. It's nice. It's nice. You have like a cheerleading group. People who are always on your side. It's beautiful. My brother sent me a text and said, "Oh, man, I love it. It's great." Similar to what you tell me, man. Just keep posting. You have all of these qualities. Keep going. So I got a lot of nice feedback.
Did you let your wife know that I'm a big deal now?
Yeah. And my wife let me know that I'm not.
You're going to your daughter's graduation day. Are you hoping that they roll out the red carpet?
100%. I want to be, identified as influencer as opposed to doctor.
Yeah.
Influencer Fawzi as opposed to Dr. Fawzi.
Yeah. Oh man, amazing.
I wear my sunglasses and just try to keep cool.
Yeah, you go wear your sunglasses indoors now. That's like the first step that you go to. No, it's like I said, it's incredible stuff, man. Like for me, it was just a case of seeing that the consistency, and then also like it's great to see somebody who actually like I feel people could benefit from listening to, like actually like get their message out there. On the message, let's talk a little bit about actually like the core of the video rather than the effect of it, which was AI and medicine. How do you feel about that whole kind of like marriage of AI and medicine? Is it, you were joking earlier saying that you were in a depressed state, but I'm sure there is a little bit of anxiety in the medical field around it, right? Around jobs.
I mean, to be honest, the more I read about it, and I'm obviously not an expert in AI, but it's going to be covering everybody's life, any aspect of life. So 100% I'm anxious about it for myself, anxious about it for my family and my children. I am going to be in trouble. There is a guy I read, like it's AI 2041 by an Asian author. I cannot remember his name. I was listening to it.
You're American, so when you say Asian, do you mean like Asian, like East Asian?
Yeah, maybe East Asian.
Fine.
Jin Tai Fang or something
Okay,
like
yeah,
that. Humble apologies to the author.
Okay.
But it's called AI 2041, and it really breaks down how AI is going to be changing every single aspect of life. And there's this one like mini story about a Ganesh. It's like a social media network, and it kind of follows like two people. One is a Dalit, and one is just a regular, middle class character, and it shows how this AI app is really trying to prevent them from getting closer, prevent them from getting married. And it shows how it uses the social media. It doesn't know these people personally, but the choices they make on social media, the ads that pop up, it would identify this person as lower class and this person as upper class. And if they marry, then the cost of their insurance should go up because of certain risks and social factors. So it talks about, and this is like 10 years from now. This is not something that'll be like 100 years from now. This is tomorrow. That how just the social media apps are collecting enough data about you to kind of be able to sell this information about risk, about your health, about your life. So, forget just being a doctor, just being a human being walking around, it's going to assess, what your insurance should be like, what your quality of life should be, what the best recommendations should be for you. This guy is clearly a smoker. It doesn't know that you smoke. It never witnessed you smoking. But based on like the hundreds of choices that you make throughout your lifetime, and then it knows that you're a smoker or a drinker or something like that, and it can make decisions and inform companies about that.
What would be interesting is if you can like predict those things, or like that pattern of behavior leads to somebody becoming a smoker. Like somebody's pattern of behavior in their teens, like they're like way more likely to become a smoker when they're an adult or something like that.
That's exactly what it is. I mean, again, I'm no AI expert, but it's all about what they call deep learning. basically you have these algorithms and these calculations where it takes like billions and trillions of data points, makes these calculations, and is able to kind of do predictions better than any human can do. So, with the X-ray itself, right? How does it know that there's pneumonia there? It doesn't look at, it doesn't see the X-ray. It just sees like maybe 2, 3, 4 million X-rays that are similar to that, and then it was able to identify that as pneumonia. So that's what it is. That it's recognizing patterns in a way that humans cannot do it, because we're not learning 24/7. We're not collecting data and correcting our data 24/7.
So what do you think that means for the doctors?
What it means for the doctors is that we have to kind of become more savvy about AI. We have to kind of recognize its place, where it's going to be taking over some of our jobs, where it will oversee what we do and what we don't do. And I think it's not clear. But there are other things that are clear. Like, for example, in finance, I think people are recognizing. In consulting, right? In legal work, what you used to pay somebody, $10,000 to write some kind of legal document, you can go on ChatGPT. That same document can be written in a second, because it's the same document, just you're changing words. So you kind of are getting this taste that there's going to be this, this baseline AI working its way through all of our jobs. And then there's going to be positions, what they are, I don't know, maybe to oversee, maybe to decide what we do better than what AI can do, and try to develop those skills.
Well, I was saying that to Kai on the last episode, that regardless of how advanced AI becomes in kind of med tech, one thing I would struggle to believe that it can replace is that empathy that you get from doctors, and kind of like that whole thing I was explaining about when I came into you. And I at that time I was very anxious as well, because I'm going through all these different things. I don't know what it means, and there was a level of, okay, let me explain to you like what's going on. We'll do this, this, and this, and there was a human to human connection there, where I was able to receive that empathy from another human and that reassurance, and that stuff that ones and zeros and text just can't do. The information would be the same potentially. It could draw me the same diagram, but what it can't do is say, first of all, don't worry about this, or we had a little bit of a laugh at the beginning and things like that. And you just and those things actually really matter, and that's something that I know you can appreciate with your background in studying psychology as well. And then those recommendations that you gave, like, hey, why don't you go and speak to I think you said Dr. Matto at the time, like, he's great at internal medicine. And there was this whole human thing that wasn't there. And so I was saying that potentially what we were discussing, Kaya and I, was that perhaps from the diagnosis or prognosis perspective, there's some benefit that AI can give, especially from a surface level perspective. But then there's always, I do think we are far from AI doing surgeries, right? And if anything, it just makes the humans better. It weeds out the bad humans. And so great doctors like yourself, I feel like, if anything, in a greater position, ones that are willing to leverage AI and not oppose it, but then also have the natural instinct to add that human element to medicine, as opposed to it just being like a diagnosis and prognosis situation.
There are going to be a lot of great doctors who are going to suffer, in my humble opinion. Now, I don't know if that's now or next year or 20 years from now, but even if you're good, it is going to be the one who can, what you said, leverage the AI and figure out how to use these devices to your advantage. Everything, including surgery, I think AI is almost there. I mean, there's robots right now that can identify, a lesion, and that can just go in there and pick out that lesion. Now, of course, there's that human element that, hopefully won't go away. But, man, these language models, they're picking up language, they're picking up voices.
Yeah.
You ever watch, there was the Big Bang Theory, where one of the characters fell in love with Siri.
Siri, okay.
Yeah, so there is this possibility that you're going to, and Siri is obviously not the greatest AI model,
Of
at
course.
least now. But there is this point where people are going to feel connected. And
Oh, well,
it's
that's
gonna
already
be
happening.
weird.
That's already happening.
Yeah.
Yeah.
So these are they're calling them AI companions.
Yeah,
That they just like learn who you are, and they teach you, and they're awake, and they're there for you 24/7.
And if you want, they will never say anything negative about you. And it's I mean, that's I think that's definitely a point where it becomes dangerous, because conflict in relationships is healthy. You improve. I know that there's so many parts of my character that's improved just because of marriage, just
Right.
by like living with somebody who's opposite to me and saying, oh, I actually prefer how you handle that kind of situation, as opposed to imagine if she was just constantly complimenting me. I would just like believe that I'm like a king, right?
Very true.
Yeah.
There's something about the struggle in life
Yes.
that helps you grow, right?
Oh, definitely.
I think, what is it called? Neuroplasticity.
Yeah.
And neuroplasticity is about struggling. And that's why, at 16 are not the same. I don't know your age, but like, 27?
Yeah.
You're not the same person, right?
Sure.
And if I even like snap my fingers and take you back to your 16-year-old self, you might not even be friends, right? Because you grew up, you grew up, you're a different person. You don't have the same values and beliefs and character because you were forced to grow.
Sure.
And this is a good point when it comes to learning, because I'm anxious about the doctors who are coming up. They don't have to struggle. They don't have to be wrong. It's very frustrating. A lot of the comments is like, oh, you looked at that chest x-ray completely wrong, and you're an idiot, I'm like, you know what? It's okay to actually look at it wrong, because when somebody actually points out that it's right, you just learned. You just learned
Sure,
the
yeah,
mistake you made and how to correct it. How are they going to do that? How are the up-and-coming students going to learn that? Because all they do is ask for ChatGPT. Hey, man, I have a patient with a cough. And okay, how long has it been cough? What's their history? Okay, this is their diagnosis, asthma. All right, well, now I don't have to think. I don't have to think, come up with a differential. I don't have to say, all right, well, if I'm going to give this medicine, what do I do if it doesn't work? Because something else is doing all the thinking for you.
Wow.
And I do worry about that, because you're
There's
100%
beauty
right.
in the struggle. Yeah, you're right.
Yeah. There's like this, there's something about contradictory thinking that I don't think AI does very well, right? It doesn't, it can only give you the answer,
That's correct.
There was like an example somebody showed
I'm just
me.
going to move your mic a little bit to face you.
Sorry.
No worries.
Yeah, there was an example, like you'd say, who was the president of United States in 1790, or before we became a nation, a republic, and it would say, I don't know, King Charles or something. So it doesn't even know
Sure.
we have a president or we don't have a president. So there's this ability to kind of know the unknown, which I don't think AI can do.
That's
so
right.
that's a positive.
Yeah, for sure. Yeah, I mean, and even then, we won't go into it, but then there's also lots of things about bias and, the people creating the models, are they going to have their own agenda, and to what extent does that agenda seep into the AI models, right?
Yeah.
Like there was stuff like about people previously asking like, I can't remember, there's some questions, there was some, and they were able to weed out some bias, like where somebody asked ChatGPT to make a joke about a certain type of individual. I don't know if it was a racism thing or if it was a religion thing. And then the AI was like, sorry, I can't do that. And then it asked it to make a joke about another type of race or religion or something. And then it made the joke. It's like, okay, clearly there's a bias here. I did want to I know we haven't got a lot of time with you, but I did want to dive a little bit into the sleep stuff, because I think even from our last episode, that's something that everybody was really interested in. Obviously, you specialize in sleep disorders, and sleep is something that affects all of us. We have to sleep. And so, of course, that would be something that was interesting to everybody, and it was. And so I wanted to dive into it a little bit more. First of all, you mentioned sleep studies earlier in the episode. I did want to just get, for those people who are listening and don't necessarily know, i.e. me, what is a sleep study? I know it's kind of in the name, but what do you actually do in a sleep study? We did go over it again in the last episode, but it'd be good to hear about it. And then not only what is a sleep study, but what is it that you look for and what do you commonly find?
Oh, wow. All right. So sleep study is essentially a study that was developed over many years to look at not 100, but like multiple parameters. So it's a study that was developed over many years to look at multiple parameters to see all these physiologic kind of points in your sleep. And based on that, we get to decide whether or not the most common thing is whether or not you have a breathing issue when you're sleeping, which is sleep apnea. But we can also see if you're having parasomnias, if you're waking up a lot at night, what levels of sleep you're in, REM sleep, delta wave sleep, all of that. And so the parameters are we're looking at EEGs, we're looking at flow outside of your nose with a thermistor, we're looking at bands around your chest, so physiologic breath, either you're expanding your chest or expanding your abdomen, looking at your oxygen saturation, looking at your muscle movements with EMGs. EEGs, looking at your heart rate, checking your blood pressure every once in a while. We look at all these parameters and just kind of determine what kind of sleep you're getting. And I was lucky enough to train with, honestly, some of the best doctors. One of them was the head of sleep in America. His name is Safwan Badr.
The head of sleep.
Yeah,
what a title.
he was the president of the
I want
American
that
Academy
title.
of Sleep.
Yeah.
Oh, Dr. Safwan. He was a very, very smart, very, very kind of insightful. And so he taught us a lot about how to look at a breath. You know what I mean? Like whether or not the snoring coming through exhale or inhale. Maybe if it's an exhalatory snore, maybe that patient is having wheezing. Maybe they have asthma. Maybe it's COPD, their issue. So he was able to kind of show us all the different ways to look at just the breath. The heart rate, you're looking at when the heart rate goes up, when the heart rate goes down, I can tell you, I think I sent maybe in the past year, maybe 10 people to the cardiologist. They were having heart attacks or, major cardiac arrhythmias. And I could tell that just from their sleep. I didn't even diagnose their sleep apnea. It wasn't a sleep apnea issue, it was a heart issue.
Oh my goodness.
So that's why I'm very passionate about sleep, because the problem is these patients are paying, upwards of 7 to 10,000 dirhams to get this full sleep study. And a lot of times the doctors are just looking at whether or not you're breathing in your sleep. But it's way more than that. It's what your heart rate is like, what your breath is like, what your blood pressure is like, what your movements are like, how much depth are you getting in your sleep. So, this is why I, humbly say you're better off with somebody like me who's trained in sleep apnea and trained in sleep medicine to look at these things, to kind of help you look at the whole picture of your sleep as opposed to just that one snippet.
What if somebody, like, you're doing a sleep study and they paid all this money for a sleep study and they just can't sleep that night? because I imagine, I imagine it to be like is that they're in some kind of lab, they wired up loads of things and then you're like, go to sleep.
You would be completely surprised how many people fall asleep or they say, I'm not going to sleep. And then like within an hour, they're dead asleep.
But is that what is the setting like? Is it like that? Is it like in a lab and they by themselves?
So the lab itself has certain rules. You have to make it very comfortable. It cannot be like a cold environment. It has to feel like a bedroom, like maybe a hotel room. So it's got to be a comfortable space, not a lot of noise. There shouldn't be any like traffic outside of that room. It should be a quiet, nice
no white
place.
Noise?
What?
No white noise?
No.
Oh, no.
No, what noise?
Like white noise to listen to.
White noise. Oh, no, if you want the white noise.
Want the white noise,
if
fine.
you want
Okay,
the white
fine.
noise, it's fine. But the noise outside, like some people, they'll set up their sleep lab and, it's in the middle of the hospital and, somebody's coding or something next door.
Someone's
That's
giving
not very
birth
good.
in like the next door unit, right next to maternity. Like, what are you doing? Okay.
No, it's happened. Yeah. So
Fine,
you
so
got to
that's
be
how you
comfortable.
okay, fine.
But if they don't sleep, we have ways of helping you fall asleep. And if you actually do not sleep. So if I don't get at least 4 hours of sleep, I offer the patient a way to reschedule and do the sleep study over again.
Okay. Another question. Are you watching them the entire time they're sleeping?
They're videotaped. So yes, you are being watched. I'm not watching them, but they are videotaped. So let's say I have a question about what's going on at this time. Then you can just kind of look at the video and watch and see what happened.
And so you then so I go in for a sleep study, it's Friday night, I go in, I see you just give me a bit of a brief, you go home, you go sleep in your house, you come in the next morning Saturday and you're like looking at my results, my breathing, and then you're watching the videotape at certain timestamps and then you're basically analyzing. Is that how it works?
how it works, except it would be a technician who's watching you and saying hello and all that. I'm already at home.
Fine, fine, okay, I understood. Yeah, right.
No, I just
yeah,
sent
you're
you
there,
there.
just going viral. You just sound like,
You know, I
farming
tell
virality.
everybody, you know, everybody does the work and I get all the credit.
Oh, yeah, fine. And do they get like a blanket? Because I imagine that you need to see how their legs move and stuff, so you kind of see their body.
Yeah, and if they need a blanket, if they want to be comfortable, 100%. No, we don't. The movements are measured through EMGs
Okay.
and videos. So if we can tell whether or not you're moving or how you're moving based on those parameters. So if you're covered, not a big deal.
Wow. And okay, fine. So Suleiman over here is he's been here for about 2 weeks. He's just done a move, and he was saying to me that since he's landed here, he's struggling to sleep. So
Alright.
I thought, we've got a sleep expert here. Why don't you tell Dr. Fawzi about your situation? I'm getting you a free consultation here, by the way. But yeah, I thought maybe we could have a listen to Suleiman and see like what if there's any telltale signs as to what's happening.
Yeah. So when I moved here, it was about like over 10 days ago. Just
Okay.
about 10 days ago.
You lift your mic up.
So yeah. At first I thought it was like jet lag or I'm getting used to the time zones because it's 3 hours difference. But I just can't sleep. So I would go home maybe around 10 p.m. I'm awake till around 1. Then just before Fajr, I'll wake up without an alarm. So like at 3. So basically I'll have about 2 or 3 hour pocket sleeps throughout the day.
All right.
So, and then I thought it would fix itself up, but I don't know if it's the climate. I don't know if it's the jet lag. I'm not sure.
Well, man, you know, definitely a consult takes time, but there's a couple things here. You're moving west to east, and it's a little harder when you're moving that way with jet lag. So it takes about 3 to 4 days. So for every kind of time zone that you pass, you should measure like 1 day to adjust. So you said it's a 3-hour time difference. So at least 3 to 4 days there. The other thing that you're mentioning is that you moved here. You're not here on vacation. So there's something called adjustment and, adjustment insomnia, adjustment disorder. Your life has officially changed. Where you go to work, how you sleep, how you earn your living, who you work with, all your environment. So there's a time that it takes for your brain to wrap itself around that. And a lot of times it shows up with inability to sleep. Now, if I were probably to videotape you the whole time, I'm pretty sure you will sleep and you will give yourself at least 6 to 8 hours of sleep. But the timing is going to be off the whole entire time because you're just adjusting to a new life.
Yeah.
If this is going on for more than, let's say, 4 to 6 months, then we would say it's a problem. But up to that, I can just easily knock it up, say that, you probably have adjustment insomnia, where you are adjusting to a new life and your sleep is just trying to catch up.
Yeah.
And it happens a lot of times. Like if somebody, for example, even if it's something, somebody they love passes away, their sleep can be, disturbed by that for up to 6 months, depending on how close they were to that person, like especially if it's a partner or wife or husband, something like that. So a move, I would say at least 1 to 2 months, you might find yourself not being able to sleep properly. That's where we talk about sleep hygiene and make sure when it's bedtime, just like when you come here to work, you want to treat your bedtime like it's a very holy, important time, that the room is comfortable. The bed is nice and soft. The blanket is there if you need it. The air conditioner is the right temperature. Because all of those kind of things will play a big role in your ability to kind of relax. Yeah.
I have another question. It might be a silly question, but luckily I'm editing it, so I'll just cut it out. If
Yeah,
it is.
fair enough.
If someone, not me, if someone was to like snore lightly,
Okay, yeah, no, you're okay. So
Fair enough.
right, Faisal, was to snore lightly in their sleep, is that like, would you say like a condition or something? Was that just sometimes normal?
Snoring is normal, all right? So one of the things a lot of us kind of as sleep doctors recognize is the fact your physiology changes completely when you sleep, right? Nobody hears you snore. Nobody hears me snore when we're awake. Nobody hears you breathe when you're awake. I don't know what this microphone is picking up, right?
Yeah.
But when you go to sleep, you can hear people breathe, right? Because the airway is narrowing. So the movement of air becomes a little bit more labored. It's a little bit harder. So you can hear people breathing when they sleep. So the snoring can show up because your soft palate kind of loosens up. We used to call it a snore. We used to call it upper airway resistance syndrome. It's nothing like that anymore. It's not even a syndrome. It's just called snoring. But your airway starts to flap. It can affect your sleep. It can affect your mood. It can affect the partner's mood, so your wife or a wife to a husband more commonly. If it disturbs the sleep of the partner, then there are recommendations sometimes to sleep in separate rooms. And because it's healthier for the marriage, it's healthier for the relationship, because your sleep is very important. It's sanctified. So if somebody sleeps very well, they're going to be in a better mood that next day. Emotionally, they'll be more stable the next day. Everybody, right? If I don't sleep very well, I'm not happy. I eat more. I'm trying to stay awake. Your brain is just not functioning very well. You're in that fog that makes you miserable. And let's say you're in that fog and you're miserable because the partner was snoring and keeping you up. Yeah, it's a very, very common problem. Sometimes the recommendation is just to sleep in separate rooms so that you can get the sleep that you want. We definitely do sleep studies in those cases, because if it is sleep apnea, it can be treated.
So basically, you have to sleep in a different room.
Basically, it's good for the relationship if it's affecting a relationship, and there should be no embarrassment about this. If it's affecting the relationship, you can offer to sleep in a different room, and honestly, it makes it better. It makes the relationship better because the other person slept well that night.
I remember you mentioning weight loss being a big factor in general health, but even with sleep, and like how the inference, these weren't your words, but the inference I kind of made from what when we were talking last time about weight loss is like, when in doubt, lose weight.
We call them modifiable risk factors, right? Like for people with diabetes, for example, we know that if they lose weight, type 2 diabetes, their diabetes is more controlled. Same thing with sleep apnea. The only thing that you can do, actually no, now there's surgeries that are available, but the only modifiable risk factor, the only thing that you can change about yourself to reduce your risk of sleep apnea is weight loss. Sadly, getting older, being a man, you can't do anything about it. And those are risk factors. Kind of the way your anatomy works, how God made you, that's also a risk factor. But the only risk factor that has been proven to kind of reduce your sleep apnea or treat the sleep apnea, may not resolve it, is weight loss.
Yeah, that's something
consistently.
That's incredible. Dr. Fawzi, Jazakallah khair for joining us. I know you had a very packed day. You came straight from the hospital today, and you have a family event as well today. So Jazakallah khair for your time. Honestly, very much so appreciate it. I love all our conversations. I love bugging you, and I love having you on the pod. And I'm just so grateful that you bless us with your time, because I know you're a very busy man. And I'm happy for your recent growth and success, and I pray that it continues, and may Allah put barakah in all that you do.
Ditto, or right back at you. God bless you, man.
Thank you, man.
Pleasure to see you all the time.
Likewise.
And meeting Suleiman too.
There we are.
We got a new friend.
Yeah, we got also a Kaya in the background.
I saw, yeah. I'll make your acquaintance after the Nice to meet you.
Alhamdulillah. Jazakallah khair, guys. Thank you guys for listening. This was episode 386 of Freshly Grounded. We'll see you soon. Assalamu alaikum.
Alaikum salam.